permission to use this video for educational purpose and on internet. Do I have your permission?
Yeah.
Now tell me about your pain and life before the surgery, which was about a year ago.
I had back pain probably since I was 16, and then I was in a car accident when I was 20,
Okay.
and that jumped it up many levels.
Oh my.
So you
How
know,
bad was the pain?
pretty bad, but I could manage it. I have a high pain tolerance
I
apparently.
know you do.
But with playing sports and stuff like volleyball would be bad. Like every time I played volleyball, I would dive or something. The
Oh,
next
my.
day I'd have to go to the chiropractor, so that got really old.
So just, and that has been going on for a year, but
Mm-hmm.
just let's say a few months before the surgery, 1 to 10, how bad was the pain?
I'd say it was like an 8. It would
8.
depend on the day. It would always bother me in the morning, like when I'd first get out of bed, or when I would have to bend down and like do the cat and dogs bowls. That would always bug me.
Yeah.
That kind of a thing.
The pain was in the back and the leg?
Yeah, the leg thing just started about, that year before, like in that summer. I remember driving to work, and like in the left leg it would start to hurt, and that was new.
Where exactly was that?
I could feel it like going down.
Yeah, we measured that, we checked that out. It was the nerve that would correspond to your bottom 2 discs. And we investigated that. And then about a year ago, we did the OLLIF, or transcambing, the minimal invasive OLLIF procedure. Do you remember the surgery?
Yeah.
Did we do it in this hospital?
Yes.
How long did you stay in the hospital?
Just overnight.
Just over the night. Next day you went home, and this is what you did. This is we put 6 screws, 2 spacers, and the bone is beautifully growing. You're a year later, and practically, for all practical purpose, that is, the fusion is adequate, and hopefully this is the last time you ever need me. But when you said next day you went home, when did the leg pain go away?
I didn't have the leg right away. I'd say it was gone.
You just woke up and the leg pain was gone? When did the back pain go away?
I would say within a couple of months, just
Couple of
because
months.
you're healing and whatever.
Yeah.
Yeah.
And right now, how bad is the pain right now?
I don't really even have any pain.
Okay. Now let's talk about few things that are very unusual for open old-fashioned surgery. Like after the surgery, obviously you went home next day. That doesn't ever happen for open old-fashioned surgery. But when did you start back working?
I believe it was in a week or so. I started
In a week
working
or
from
so.
home,
Yeah.
and then worked I'd go into work for half a day for
Okay.
about a week, and then after that it was back to work. I'd
So-
wear the brace and whatever, and
Yeah. So within a week you start really working again. How long were you taking pain medication after the surgery?
I don't know if that was like maybe a week or so. I mean, I didn't take it when I went back to work. I know.
So you had years of pain. We did the surgery. After a week or so, you didn't need pain medication.
Yep. And
That's
it's and it's really weird. People ask me about it, and I'll say that I was so used to the pain that now that I don't have pain, it was really hard to get used to.
Yeah.
Because you're surprised what your new normal is.
Yeah. Yeah. That's now sometimes, and that's a good kind of surprise, though.
Right.
How is you want to go back to sport and so on, and that's a very good question for lots of my patients. The idea is you can do whatever your body let you do. Obviously, one of the dangers here is that people feel good and they want to do too much. And when you start doing sport and activity, your adrenaline is high, so that suppresses the pain. So how your pain is while you're doing it is not a good indication about what you can do and what you cannot do. But a good way to deal with that is doing a little of whatever you want to do. Then watch yourself for a few days. If after a few days your body is still okay with that, then you add a little more and you go slowly up until you find your threshold. And believe it or not, with or without surgery, everybody has a threshold. You just have to find it out in a safe way.
Right.
You said you have already started doing some activities. Tell me about what are you doing?
Yeah, mainly just cycling. Before, I ran like marathons, stuff like that, but really I did cycling and body pumps, so I've been really careful. Even at lifting weights, I'd like to do it, but I did want everything to be okay before I started it up again.
Everything inside is okay. You can do whatever your body let you do, but listen to your body. Your body is not your enemy, it's your friend. Just work with it, but slowly increase the activity and watch yourself for a good part of a week or so. And if your body's okay with that, just add a little more to it until you find out. There are 2 effects here. First of all, you find your threshold, and second, if you go slowly up, your body adjusts to that. Whereas if you go from nothing to running marathon, not only you can make damage where we did the surgery, you can make damage everywhere else too.
Right.
Yeah. So I think you have a good common sense. You'll be all right. Any other question for me?
No.
No? Well, in that sense, I hope I never see you again. Okay? It's a good thing not to see me. Okay? Thank you. I appreciate that.